The gang is here. Is the winner taking it all again? Did the hustler stop reggae or the train itself? The big show at the Bomas of Kenya and the Bromas sparks alive again, even if momentarily. The memo tonight comes from a quiet bench somewhere in South Korea. The punchline tackles politics of segregation and the kicker kicks against gifts and kicks for empowerment of the youth. And on My Take tonight, have you washed your hands? And of course, Joe Ageo is away tonight, but his angle will be back next week. Before we get to the show at the Bomas of Kenya, let's listen to the Cabinet Secretary in charge of health terming October as the worst month ever since the first case of COVID-19 was reported in the country.
We are essentially in some sort of second wave of the virus infections in our country. On the first wave, the highest point, the highest positivity rate, round about July, was about 13% positivity rate. The day before yesterday, we had a positivity rate of 20.2%. Yesterday, we were at 15%. Today, we are once again at 15%.
Some grim statistics there, Jamila. Clearly, we're not heading in the right direction.
No.
What happened?
I have no idea what happened, Yvonne. I wish I did. But when he says the second wave is here, and I think we had someone saying, one of the experts saying that we were not even out of the first wave yet.
Dr. Amot.
Yes, he said it, and we're not. Now we are hearing that we are in the second wave. It's worrying because when you look at the statistics that he was talking about, today is 29th of October. I think this is 29th of October. The positivity rates, other than for only 2 days, they've been 5 and above. And the highest, of course, was the 20% that he's talking about. And then, but still, we have the sample size of 6,000. I think it's the highest, so it was 7,000, 4,000, 3,000. And then 15%, 20%. That's really worrying, number one. Number two, the other worry that we are witnessing now is the increasing number of infection in counties that are outside Nairobi. Bungoma is one. Kakamega is another one. And Nakuru is another one. Kisii and Kilifi, those are counties that had not had such high number of infections in the beginning. Now we are seeing that. And then this is the case that is being seen all across the world. Yes, we are told find local solutions for COVID-19 in your countries, but you cannot ignore what's happening all across the world. In Europe, I was just reading about how countries like France has announced a second national lockdown. Starting tomorrow. In Germany, restaurants, cafes and bars are going to be closed in November. In England, they're experiencing almost 100,000 new infections every single day. Spain has announced a new state of emergency because of the infection that is sweeping through Europe. The US is almost at 230,000 dead from COVID-19. So this is not a joke. But something that the minister said today really got me thinking. I was upset to some extent, and to the other, I didn't know what to say about it. When he says, don't go to political rallies. So wanasiasa wakiwaita to go for political rallies, don't go. Maybe if you don't go, they'll stop calling them. Why not tell the politicians, don't call the political rallies?
But yet, he does find himself in a tough position, doesn't he? Because some of those rallies are called by his bosses.
Very tough place, Yvonne, and it is a test for the leadership in this country because we are caught between doing the right thing and doing what is convenient. Now we're in the middle of a lot of political activity. The BBI report has just been launched. It's supposed to be marketed around the country or something like that. What will happen going forward is a situation where we'll have to make very, very tough decisions because the numbers are telling a very, very grim story that COVID-19 is ravaging the country. It was very shocking to see what has happened with some of the counties, including the unfortunate death of some officials in those counties.
Right.
This is a very worrying situation because what it also means is in offices, this pandemic is doing a lot of damage.
Yeah, that's right. And just in time, because the president has now called for another extraordinary summit with the county governors next week. And are we likely to see a return to some of the restrictions? We've even heard the CS Mutahi Kagwe, hinting at that today.
I will not be surprised at all. And these are the reasons. Look at the number of positive cases that Jamila is talking about, but I'm more concerned about the number of fatalities.
Yes.
The number of deaths, initially we used to talk about 1 person, 2 people, 3 people, and even those are too many still, yeah? But I want to draw your attention to the statement by the CS today, that we have lost 54 lives up until yesterday to the disease this week alone, 54. Today, we lost another, or in the last 24 hours, we've lost another 14 patients. So it brings to total 964 deaths so far. We just about 36 shy of 1,000. Then 1,084 patients are admitted in our health facilities, 35 of them in intensive care unit, 14 of them on supplementary oxygen, and 18 on ventilator support. 40 patients who are separately on supplementary oxygen, and 24 in HDU. These numbers are not looking good. Combine this with the number of ICU beds that we spoke about not so long ago, right, and the state of preparedness in counties. Jamila says the disease is now moving from Nairobi to other counties. You would consider that Nairobi is more prepared, so to say, in terms of handling this. But if you're getting serious cases in Bungoma, how many ICU beds do they have? How many ventilators do they have? So if there was a serious wave in those counties and they have no capacity to handle the situation, then it's a serious crisis. Not so long ago, we were talking about Kakamega, actually today. Yeah. And there's a serious situation there. So we are in a very bad situation as a country.
I think, Yvonne, before Geshuri speaks about a serious situation, something else that we've noticed in the past few days is how COVID-19 is starting to affect teachers in schools. Yes. We've had Tononoka and the Star of the Sea. Yeah, the headmaster died and the school was closed. And I was listening to a story today about a teacher who passed away at Nakuru Hospital. And in total, the statistics show that 33 teachers, 17 students, and 7 non-teaching staff have been confirmed to have contracted the virus. Remember, we were supposed to open there was the indication that the other classes were going to be opened from actually 26th of October. The second phase was supposed to start. That hasn't happened yet. Minister Magoha was saying, no, not yet. We're not going to ask the kids to go back to their home. We're not going to close the schools. But it's important to note that COVID imeingia kwa shule sasa, especially now that we have those students in school now.
Absolutely. Yeah. Back to that.
And Yvonne,
yes,
people are looking for certain answers, but that has not been possible. Yeah. And I don't think it's going to be possible because, like it has really been widely accepted, COVID-19 is a new situation.
Yeah.
When you see Professor Magoha looking like it doesn't have answers, it's because he genuinely may not have answers. Yes. Because how do you know how to act?
That's true. Yeah. And the one thing that we do know, in the absence of a vaccine and a cure, is just increased vigilance, I think, amongst the people. Like, let's try, I think, perhaps, and work within our spheres of influence. And one of those things that we have control over is our behavior and our adherence to the guidelines. Perhaps that's the only thing. I mean, just if you take a look at those numbers, in the month of October alone, over 250 deaths. Apparently about 258, if I'm not wrong.
Yep.
If you take that as a percentage of the total deaths in the country to date, that is about 26%. That's close to a third of the deaths from March have taken place in just this month
October
alone.
Only.
So, I mean, it clearly is a very worrying situation. And for what we do know, let's practice what we know. What we don't know, we'll figure that out as we go.